Hello and welcome to Women's Football Hub. I am your host for this episode. I am Carolyn Kent, and with me today is a person who is an expert in breast biomechanics and injury prevention in sport. She's over 20 years of experience as a sports physiotherapist, researcher, and educator. She's led groundbreaking research into breast health and its impact on athletic performance. She is also a professor at the University of Wollongong. Welcome to Women's Football Hub, Professor Deirdre McGhee.
Thank you very much.
And I can't thank you enough for coming on because I know how busy you are. And I was telling you, obviously, before we came on, how much of an impact you've actually had. So, chat to me about, first of all, how you got into your research in breast biomechanics.
As a physiotherapist, I was treating women with neck pain and shoulder pain, and I noticed that their bras were not holding their breasts up, that their breasts were actually pulling their trunk forward. And so I started adjusting women's bras. And from that, I had this one little dynamic patient who then said to me, look, you're complaining about these bras. Why don't you design one yourself? Because I would be drawing pictures of bras, and this is what I want you to look for in a bra. They would bring all the bras to the clinic, and I'd say, we'll take this one and go up a cup or go down a cup, or I'd be modifying their size. So then I designed my first bra back in about 93. And realised that's a really hard thing to do as a sole person. And so I moved into sports physio, and then I started noticing female athletes that I was working with, and I was just sitting on the side of a court, as a sports physio does, watching how much their breasts move. So then I started interfering with my female athletes and saying, you've got to stop your breasts moving so much. And what we found is that they found it more comfortable and found it easier to run. They had a more upright posture. So then I ended up, because I was teaching anatomy at university at that time, I met Professor Julie Still, and she talked me into doing research, which I had no plans on doing. And it all goes from there. I started looking at, I said, we have to look at design and fit, because this fit was such a problem. Because as a physio, all women take off their tops when you're treating them. So you see lots of bras, and I was able to see that the bra fit was really a problem. And then I measured it and found out it really is a problem. And then same thing with design, looking at how to support the breast. And I think because I had a strong background in anatomy and biomechanics, I was just able to understand how to support the breast.
And from a perspective of breast support, then, why is it important for kind of athletes to be well supported, and how does it impact their performance on the field?
I think athletes are really surprised at how much their breasts move when their body moves. So your breasts are attached to the muscles of your anterior chest wall on the perimeter of the breast. And then they just have the overlying skin as support. So you don't really have anatomical supports for the amount of breast movement that's involved. So say if an athlete runs for an hour, her breasts will bounce about 10,000 times. And they're going to move from, we talk about the magnitude of the movement as well. And breasts do that when a woman runs, and they're going to do that when she jumps, and they're going to do that and that when she plays tennis. So women are, when you get them to look in a mirror and watch their breasts, they go, wow, I had no idea they move that much. So because of that amount of breast movement, that affects how they hold their trunk. And so if your breasts are moving excessively, what women will do subconsciously is brace. So women will hold those muscles firm, and there's multiple muscles around your chest, your pec, your serratus anterior, your external oblique, your pec minor, and your rectus abdominis. So you've got these multiple muscles that are working to try and hold your breasts when you want those muscles to play your sport. A sports bra that limits breast movement, we've found, is not only more comfortable for women, and this is the difference of pain versus comfort. Okay, so women with large breasts tend to have pain associated with that movement. But women who I put in high support bras who have previously had no pain say, I am far more comfortable in this. So it depends what we measure as a researcher. So comfort is quite surprising that they go, I had no idea, I wasn't in pain before, but wow, this feels so much better. The other thing, it helps to hold their trunk upright. And holding your trunk upright is essential to moving your shoulder correctly. So if you hunch over your shoulder and lift up your arm, you'll have a limited range. Whereas if you hold your trunk upright, you'll get full range. So for the health of your shoulder, it's far better to have your trunk upright. And for the muscle strength around your trunk and shoulders, because muscle strength is specific to the length of the muscle, if you want to optimize your muscle strength, you really need good posture. Okay, that's just basic anatomy and biomechanics. So what we've found is if you wear a high support sports bra, you're more comfortable, your trunk's in a better position, you optimize your shoulder range of motion, you optimize the strength of the muscles of your upper torso, you actually even land better. So when we talk about landing, that's when you run, every time your foot hits the ground, that's landing. And the alignment of your lower limb is actually more optimal when your trunk is upright. Like that whole story, hip bone's connected to the knee bone, right? That song that we learned as children is true. So if you have better posture in your upper torso, you have better alignment in your lower torso because your lower body, because it's connected. So it can optimize how you land. And when there's people that have actually measured running economy. So they've measured how much energy it costs for you to run. And again, it's all based on that upper body posture. If you have a more upright posture when you're running, then your running economy is better. So to optimize your performance and to minimize your risk of shoulder issues, overuse issues, and God forbid, just to be more comfortable as an athlete, why isn't that enough? You know, women who are involved in sports that involve running, jumping, or forceful arm movements should be in a high supportive bra. If you're doing something like yoga, so there's not much trunk movement, not much breast movement, it's not so important. It's when you have substantial breast movement that it's important.
And I suppose just listening to what you're saying there, obviously you were saying the breasts move up, down, left, and almost in that sort of figure of eight. But what you're saying there about posture with regards to arm movement, I suppose for positions like goalkeeping, for example, in football, that's going to be really vital to make sure that if they need that agility of the shoulder, they're going to have to think about a decent sports bra. So what should players then look for in a sports bra to ensure it provides the right level of support?
So there's three types of sports bras on the market. And I've been educating athletes for years. And I've also been through shopping with women for years. Because of my expertise in this area, I've had teams, I've had clinicians, I've had women go, come shopping with me. And I'm just exhausted shopping for bras. And women hate buying bras. Like women hate shopping for bras. So that's why I made an app, a free accessible app that is used by women all over the world. It's got global sizes, and it goes through and explains first to say there's three types of bras on the market. There's a crop top, which holds your breasts against the chest wall, right? Compresses your breast, and that's how it limits breast movement. So if you're choosing to wear a crop top, that crop top has to be made of strong elastic. It has to have a strong wide band, it has to have wide straps, and it has to completely cover your breast. And women are often surprised about how high their breasts are on their chest wall. So I say to women, put your hand underneath your breast and then put your hand at the top of your breast and push up, and you'll feel how high your breasts are on your chest wall. The crop top has to cover the whole of the breast, and you need to feel that your breasts are squashed. So if your breasts do not feel squashed, it's not working. Okay? So that's a crop top design. You can't have them too squashed that they're uncomfortable. We can't go the other way, right? You're just going, oh my God, right? But they have to be firmly compressed. That's how a crop top works. The second type of bra is called an encapsulation bra, and that's what women mainly wear as fashion bras. That idea of the breasts are held in two separate cups, and they gets its support by lifting your breasts. Okay, so your breasts should feel lifted. If your breasts are hanging, so you don't have a bra on and you think, what's the height of my nipples on my chest? If you put the bra on and they're still at the same height, you might as well not wear a bra. Like they've got to be lifted, right? So that's the whole point. And lifting them up helps you stand upright. So it's in your interest to lift them. So this encapsulation bra, hold your breasts in separate cups. Same thing, it has to have a nice wide band because it's lifting them from the band, and that has to be strong, elastic. And then the straps need to be wide and padded, and these are adjustable, so you have to adjust them that they're firm enough that they stay in place, but they're not too tight that they're uncomfortable. You shouldn't be able to slide them off your shoulder, but they shouldn't be cutting in. And then that cup has to cover your whole breast as well. You don't need to feel the compression like in a crop top, but you need to have the lift, and they need to be completely covered. This front part of your bra, right between the cups at the front, is part of the band. So you can't have a nice wide band at the back and then go to nothing here. This is the band. So it has to be a decent bit of stiff material between the cups to hold up the breast weight. The last type of bra on the market is called a hybrid bra or a combination bra, and that's because it's a combination of those other two. Right? So when you look at the outside of it, you'd think, oh, it's a crop top, right? Because it's got this, should have a high round neck, should have wide straps. But when you look inside the bra, two separate cups. So the hybrid bra does a combination of compression and lift. So there's some lift, there's some compression. You don't need the level of compression you had in the crop top, and you don't need the level of lift you had in the encapsulation. You've got a little bit of both. And so with the hybrid bra, it again, same thing, wide straps that are adjustable, has to have this high round neck so it's compressing your breast. It has to have strong elastic band as well. So that same criteria fits. A hybrid bra can do up at the front or it can do up the back. It can be a racer back, like so there's lots of different designs. With the encapsulation bra, you don't have to have underwire for it to be supportive. If you choose to wear underwire, that's fine, as long as the underwire fits. So the underwire has to be sitting on bone. So it has to be sitting on bone at the front and bone near your armpit.
And I think that's the thing, and I certainly, having played kind of football myself, I've always found that at some point you can wear your sports bra, but then if you're going home, you can sometimes start to find it uncomfortable. So are there any sort of advancements with regards to sports bra technology that you believe are game changers for athletes? Is there anything coming on the horizon or has already been put through?
I think I've been doing this for nearly 25 years now, and I've seen big improvements in sports bra design in that time. So the design features of them, but also of the material and the seams. I think that's what's really been made big improvements in. The clips that they're using are so much flatter. They're gluing parts of the bra together to minimize seams, and they're having nicer, smoother fabrics that have good elasticity in them. So I think the material and the seams are really where bras have really advanced and developed over the past 25 years.
And I think when we talk about coaches and teams, what are the kind of more common issues that players have faced with regards to breast pain or discomfort? What have you come across with regards to trying to implement sports bra technology with coaches and teams?
I think women are silent sufferers. So I think women don't talk about breast pain. So women have breast pain associated with breast movement, and that's more women with larger breasts that suffer from that, and older women. Then women get, between when we start menstruating pretty much till we end, there are women who have breast pain associated with their menstrual cycle, and we call that mastalgia or cyclic mastalgia. And then it might be a couple of days before their period, they go, oh, my breasts are, and some women increase a whole breast cup size because their breasts swell. So in terms of managing that pain, that wearing a higher support bra on top of pain relief and evening primrose, like there's a lot of strategies women use to manage that pain, but wearing a higher support bra during that time is actually far more comfortable during sport. And then other women have chest pain due to musculoskeletal issues. So it's really important that we look at what are the issues of what's causing that pain, that women don't just silently suffer, that they actually report their pain to a physio or a doctor to try to go, can we manage this for you? Because that pain, we know, is perceived to negatively affect their performance. So even though these women are warriors and they keep playing with that pain and they're silently suffering, we know they don't play as well. So to actually talk about it and we try and address it is really important. And what our research has found is that most coaches are completely unaware that women have this pain, that women are silently suffering. So that's part of it. But we also, with male coaches, we're working on helping them to have safe conversations with their athletes, because that's not an easy topic for a male coach to bring up, and it can create miscommunication or issues between the coach and the player. So that's where we're working with Rugby League in Australia and working out safe lines for male coaches to say to female athletes to try to address breast-related issues. And we know one of those is that about sports bras. Mm-hmm. And what we teach them to say here is that a sports bra is a piece of sporting equipment. So you are in your rights as a male coach to talk about a sports bra because it's equipment. Okay? And you need to sell to your athletes that they need to optimize their equipment to optimize their performance. So your sports bra, and we just say, that's all you bring up. And then you refer them to the sports bra app, which is www.bra.edu.au. It's very simple. www.bra.education.au, Australia. And that you say, you need to optimize this, have a look at this app and go shopping. And what they normally see is that the athlete is either bracing or they're not running. It's running and jumping and false alarm movements. They're the things that really muck an athlete around. But their breasts actually just move excessively. So I'll have a male coach yelling at them going, run faster, swing your arms. And I'm going, have you seen how much their breasts are moving? They're actually bracing. So if you want them to run better, you need to so that they can.
And I think that's it. And what you've said there about kind of female athletes being silent sufferers, there'll be some female athletes that probably have breast injuries but don't want to talk to anybody about it. So what would be some of the more common breast injuries that female athletes might get?
I think we need to be really clear at what's an injury and what's a health, right? So when we talk about breast pain associated with breast movement or cyclic mastalgia, that is not an injury. That's women's health, and you're trying to optimize their health. When we talk about a breast injury, that's where a woman gets an impact to the breast that causes breast pain, bruising and swelling. So there's been some researchers that have brought these together, and I'm going, keep them apart because they're two different issues. An impact to the breast, that's a sports injury. That's a female specific sports injury. And this breast pain and sports bra design and bra fit, we're optimizing the health of our athlete to optimize their performance. And both will create breast pain. So I'm going to try to keep them separate because we're just confusing our athletes. When we talk about injuries, there's two. One of them is an impact to the breast. And that's normally someone's in football, it would be someone's elbowing their breast, or they fall to the ground with their arm out and they impact their breast to the ground, or they're chesting the ball and it's impacted their breast. So something's actually hit their breast and it results in breast pain, bruising and swelling. Now that's important for an athlete to report because breast tissue is far more delicate and complex than muscle tissue. So athletes will say to us, oh, I get bruises all the time. I move on. I'm a female warrior. And we go, you love your breasts and there can be complications to your breasts. And if you tell us and we manage it, we can prevent that. Playing soccer, you can play, or playing football, you can get concussion, you can tear your ACL, you could impact your breast. We need to manage every injury that you could have. The other injury is trauma to the skin. And that's chafing from the bra rubbing up and down the bra and up and down the torso. So because women are often sweating a lot, playing in really hot environments, they can have friction to the skin that causes chafing. Again, we can treat that, and we look at protecting your skin, putting a barrier over your skin. We look at, is your bra fitting correctly? We look at the design of your bra and can we modify that for you? And again, physiotherapists can manage all that for female athletes. So you don't have to put up with that. We can actually treat it.
And for the physiotherapists who kind of, or even the student physios, because we got a lot of them listening to this podcast, if they were going in to kind of work with a team, how would they potentially support players in addressing breast health?
I think you need to know your team. And for athletes to report, so say with the research we've done on breast injuries, where athletes are getting impact to their breast, 90% of those athletes do not report their injury. Okay, so we need to break down this barrier to get athletes to talk about breast-related issues. So they need to feel safe, you need to be trusted, and they need to know you in order to do that. And then you raise awareness. So I think primarily this, until we normalize this, until we get this integrated into sport, this needs to be female-led. So we need female physios who are trusted by their team and known by their team in a private, safe environment to give their athletes education, and not too much. So I think we have a tendency to want to bombard athletes with information, and I think it doesn't work because it's not so interesting, it takes too long, so we have to minimize down. So the things we say to make sure athletes understand breast injuries are occurring in sport and that we're clear about that impact to the breast. Is that what we're talking about? Athletes don't report them, but they negatively affect their performance, and we can help you. We're not going to take you off the field. We're going to help you, and we're going to manage that so that you don't have any long-term problems, but also that your performance stays at peak while this tissue is healing. And then in terms of sports bra design and bra fit, is we go, this is sporting equipment, and we want to optimize your performance, and we want you to be as comfortable. Part of that is that you're as comfortable as you can while you're playing, so that I can help you with that fit and design so that you play to your best.
And I think it's interesting, isn't it? Because I think the jumps forward in sports bra technology have been great, but as we know, when we look at sports engineering and sports technology for women, I think there was only 32 published studies at one point. What do you see the future holding with regards to kind of breast health for female athletes?
I think that we're really at the stage of implementation. We really need to implement this education so that it spreads throughout sport. I think thank you to all the wonderful female athletes who have struggled and fought for how many years to get recognition and get opportunity for women in sport. And I think those women have had this ripple effect, not only for opportunities for sport, but opportunities for health and opportunities for performance. Really so excited to be part of this movement of female athletes and women's sport. And along that, let's optimize their performance by managing women's health. So we're using sport as a vehicle to get women's health out to women around the world. And breast health is just one component of women's health. But when we talk about menstruation, we talk about pelvic health, and then we talk about helping women to have a career and still be a mother and have children. So all fertility and pregnancy and postpartum, there's all these topics that we can help with female athletes, that I think that this is using sport as a vehicle to optimize women's health around the world. Very glad to be part of this movement.
And the movement, let me tell you, is very glad to have you. From a perspective of kind of key takeaways, what would you want female footballers and their coaches to know about breast health?
I want them to know that you don't have to put up with breast pain, that you need to talk about it, and you can be helped by physiotherapists. They're an ideal profession to help you. You need to make sure that the bra you wear during sport is supportive enough to limit your breast movement and that it's correctly fitted. And you can use the Sports Bra app to help you work that out, right? It's really important how you care for your bra. So sports bras are expensive and you can trash them really easily, right? So if you put them in a washing machine on a hot wash and then you put them on a dry, do not expect them to last long. So if you want to maximize the lifespan of your bra, you should be washing them in a bag, in a machine, on a gentle or a cool wash, and you never ever put them in the dryer, and you don't hang them on the line from your band, you drape them, and they will last you so much longer. Especially when I've been at competitions and traveling with teams, and they all just put their bras in the hotel laundry, and I've been in competitions that have gone for 3 weeks and the bra's done. I go, let's see, it's gone. This was brand new bra and you've trashed it in 3 weeks. So do not put them, and I'm quite surprised how they've gone, how am I going to wash it then? I go, what about in the sink in your hotel room and draping it in the shower? And it's come to the point they go, oh, I can't do that. And I go, okay, wear it in the shower and wash it on your body and then take it out and drape it. So I think we just have to work with athletes to try to go, what are you willing to do? And just like any relationship, it's a compromise. And that's why you need to know your athletes and they need to trust you so that you can optimize their behavior.
Never let it be said that this podcast doesn't also give out life lessons, by the way. I really like that. So if any of the listeners have been inspired by what you said today and they maybe want to catch up with your research or access resources in this topic, where can they go to?
So I have a webpage. Breast Research Australia has a webpage that they could go to. But also if they go to the app and there's a little bar at the top and it says more resources, they can just click on like years and years of papers if they're interested in reading so much research. Another really good resource for people to look at is the Australian AIS. If they put in AIS and then space FPHI, the Australian Institute of Sport Female Performance and Health Initiative. I was part of a group that we made these suite of online resources covering everything, every topic of specific to female athletes. And I wrote the breast health module, and that's 15 minutes. It goes through sports bra design and bra fit to optimize performance. It goes through breast injuries, and it also at the end goes through breast cancer awareness. And the reason we talk about that with female athletes is because after you have trauma to your breast, we want to make sure that breast tissue returns to normal. And women have this wide range of shapes and feels of their breast. So we say to women, you need to know, all female athletes need to know the normal look and feel of their breast to know that, this tissue, my breast tissue's gone back to normal. So you need to know what you're like. So that's why we teach that breast cancer awareness, and we wrap it up with breast injuries. And on the other side, even though athletes in their teens and 20s, of course, your risk of getting breast cancer is extremely low. So they feel it's not really relevant to them. But as you age, if you start this habit now, just like stretching, as we start with children, start with female athletes when they're 5 and 6, we start them stretching, even though really they don't have flexibility issues. We're starting a lifelong habit that as you progress through your life, where risk of breast cancer can increase, you're already there.
I have to say, I could probably talk to you all day, but that's unfortunately all we have time for today. I want to say thank you so much for coming along and chatting. I know how busy you are and how difficult it is to get a hold of you as well. And also thank you very much for everything you've done for female athletes, because I think that the impact that you've had on all sports is something that is to be admired. And I want to say to everybody that's listening, don't forget to follow the Women's Football Hub podcast. And more importantly, please also follow the evidence when it comes to breast health. Until next time, thanks for listening.
Thank you for listening to Women's Football Hub. The information within this podcast is for informational purposes only. No material on this podcast is intended to be a substitute for medical advice, diagnosis, or treatment. Please contact your doctor or another healthcare professional if you have any questions about anything raised in this podcast.